video talking about job hunting tips for physicians, and I mentioned that you could negotiate on resources as compensation for physicians. As a physician, your intellectual property, your brain, is your biggest asset. Maybe as a surgeon, you might have other things like your surgical skills or your suturing techniques and all of that that might come into play as well. But even in that circumstance, I think on a greater scale, your intellectual property, what you have in here and how you think and how you reason, is the biggest asset that you have to offer a company. That is the way that we should be thinking. You want to ensure that you start working for companies that know that it's so important for you to be able to constantly, regularly be able to expand on that knowledge base. Because once you leave residency, that's your baseline, but things will always be changing after residency, and you still have to keep up to date with that. I want to be working with companies that are going to sponsor me time to be able to put into expanding that knowledge base, whether that is actual time that I'm able to have to study, and that's called CME hours, or continuing medical education hours. The average amount, I think in the US, I'm just speaking in the US here, is anywhere from 3 days to 5 days. Now, they may be some places that have more than that or less than that, but the average amount of CME hours that most institutions offer is 3 to 5 days. Other way that they may offer is CME dollars. So they may offer you money, like actual physical dollars that you can use to be able to buy things that help to expand on that knowledge or that skill set. So that could be money that you can use to buy a course, use to attend a conference where you can learn more things, attend classes, or buy equipment that you might need. So for instance, Dermoscope, which is a tool that we use in the office to look at different skin lesions. You can use your CME money to buy those things, because no one wants to use their personal cash to be able to buy or spend on those things. You might in some cases or in some instances, but generally CME dollars are super important to me. Search engines, UpToDate, Medscape. There are all these different options of search engines that companies can pay for you to have a membership with. With UpToDate, you can also gain CME credits. So if you have your own personal membership on UpToDate, every time you search something up or every time you read up on a topic in UpToDate, it counts as a very minute amount, but it counts as a CME credit that you could use to earn towards your CME